Hello, my name is Michelle Matthews, and I'm the owner of Matthews HR Consulting Services and an authorized OSHA outreach trainer. I have over 18 years experience in human resources management, safety program development, and workforce risk mitigation. I know you and your team are working hard to create a safe return to school, and I know the steps outlined here are easy to say but difficult to implement. They will require extraordinary effort and flexibility. But working thoughtfully and together, we can do what we can to allow students to return to school as safely as possible. The CDC has created overall guidance as well as guidance tailored to the transmission level in your area to help child care programs, schools, and their partners understand how to help prevent COVID-19 and react quickly when a case is identified. We're going to cover the CDC's general guidance, but you will need to check with your state and local governments for additional guidance. Big picture, the CDC says the best way to prevent the spread of COVID-19 is through social distancing and disinfection. While we've all heard about wearing face coverings, washing our hands, and keeping 6 feet apart, today we're going to see how we do those and much more in a busy school environment. And while we cannot discuss every possible scenario, we will cover some of the most common. Let's start with masks. The CDC and OSHA are advising all wear simple cloth face coverings to slow the spread of the virus. They are meant to protect other people in case the wearer is unknowingly infected, since many people carry COVID-19 but do not have symptoms. Accordingly, face coverings should be worn by staff and encouraged in students if feasible, and are essential when physical distancing is difficult. Masks are challenging to wear all day, but as an administrator, you will want to lead by example and reinforce use of face coverings among staff and students by wearing them yourselves. Post signs on how to stop the spread of COVID-19, properly wash hands, promote everyday protective measures, and properly wear a face covering. A link for some signage is in the downloadable resources area. For staff and older children who can safely use hand sanitizer, ensure that adequate supplies are available to support healthy hygiene, including soap, hand sanitizer with at least 60% alcohol, paper towels, tissues, and if feasible, no-touch trash cans. It is important to increase the number of hand washing and hand sanitizing stations throughout the school, including all entryways, all hallways, all water fountains, and areas where food and drinks are consumed, and any other areas where students and teachers have a high number of touch points. Key times to clean hands include before, during, and after preparing food, before eating, after going to the bathroom, after blowing your nose, coughing or sneezing, before and after work, before and after breaks, and after touching frequently touched surfaces such as handles and handrails, before putting on a mask, and after touching or removing your mask. And always avoid touching your eyes, nose, or mouth. Using warm water and soap for at least 20 seconds is key. Ensure you use a generous amount of soap and water and get all areas of your hands, front and back, in between fingers, and underneath nails. Cold water is not as effective as warm water, but it's better than no water at all. To dry, use clean paper towels and avoid using dryers, which do not dry hands as thoroughly as paper towels. Use the paper towel to turn off the faucet and use the paper towel to unlock and open the door when finished using the restroom. Note that alcohol-based hand rubs do not work effectively if hands are visibly soiled. If hands are visibly soiled, either plain or antimicrobial soap and water should be used first. When performing hand hygiene with an alcohol-based hand rub, apply product to the palm of one hand and rub hands together, covering all surfaces of hands and fingers, until hands are dry. If hands feel dry after rubbing together for 10 to 15 seconds, it is likely you did not apply a sufficient amount of the product. This may require 2 or 3 rounds. If so, consider adjusting the amount of sanitizer that is released with each application. Alcohol-based hand rubs must contain other ingredients such as chlorhexidine to achieve long-lasting effectiveness. Maximizing airflow is critical to reducing virus concentrations. Make sure ventilation systems operate properly. Guidance suggests you inform facilities and maintenance to keep the air running constantly instead of using the auto fan option. And increase circulation of outdoor air as much as possible, such as by opening windows and doors. Do not open windows and doors if they pose a safety or health risk to children. For example, allowing pollens in or exacerbating asthma symptoms. Current evidence suggests that SARS-CoV-2 may remain viable for hours to days, including 3 hours in the air, 24 hours on cardboard, 2 to 3 days on plastic, and 4 days on wood. Unfortunately, we do not know how long it survives on fabric, shoes, or hair at this current time. It is important to clean and disinfect frequently touched surfaces within the school, outside areas, and on school buses at least daily, as well as shared objects between uses. For example, door handles, sink handles, and drinking fountains. Let's go over proper disinfecting procedures with either the spray, wipe, spray, or wipe, dispose, wipe method, and then I'll show you some examples of how to disinfect surfaces. For liquid disinfectant, use the spray, wipe, spray method. Spray the surface with the disinfectant and wipe it using a disposable towel to clean the surface, followed by another spray to disinfect the surface. For disposable disinfectant, instead of the familiar circular pattern, use the wipe, discard, wipe method. Use one wipe to clean the surface, discard the wipe, and use a second wipe to disinfect the surface. Wipe in a straight line, then fold and wipe the rest, but like this, and not the familiar circular motion or the back and forth motion. For disinfecting electronics, follow the manufacturer's instructions. If no manufacturer guidance is available, it is usually okay to disinfect touchscreens with wipes or spray containing at least 70% alcohol, but again, you should confirm independently. Be sure to dry surfaces thoroughly to avoid pooling of liquids and use the spray, wipe, spray method or the wipe, discard, wipe method we demonstrated earlier. Phone touchscreens can usually be cleaned using disinfectant wipes, but check with the maker of your phone first. Use a speakerphone when possible or headset touch-free devices to reduce the need to hold the device to your face. If used often, your device will require frequent disinfecting, but most need only be wiped down once or twice a day. For example, at your lunch break and the end of the day. And most aftermarket covers are wipeable. Ideally, it is best to not share devices. However, if the school resources require the use of shared devices, for example, iPads, laptops, copiers, laminating machines, etc., ensure each person is disinfecting before and after each use. For light switches, thermostats, handles, and handrails, and the like, use the spray, wipe, spray method or the wipe, discard, wipe method. Longer-term motion-activated lights and foot handles or even motion-activated doors help keep employees and students healthy, even after we get through COVID-19. For keys and key cards, use the spray, wipe, spray or the wipe, discard, wipe method, including the holders, fobs, rings, etc. When disinfecting desks, sinks, counters, bathrooms, toilets, floors, and any other surface, diluted, unexpired household bleach solutions can be used. For diluted bleach, be sure to use at least 1,000 ppm of sodium hypochlorite. Please see the resources area of the training for a dilution recipe. And be sure to follow instructions for application and ensure a contact time of 1 to 15 minutes depending on the manufacturer's recommendation. If your school has elevators, limit the number of occupants to 1 per car. Urge all to consider using the stairs if possible. Wear disposable gloves when cleaning and disinfecting surfaces. Gloves should be discarded after each cleaning. If reusable gloves are used, those gloves should be dedicated for cleaning and disinfection of surfaces for COVID-19 and should not be used for other purposes. Here's how to put on and remove gloves safely. Wash your hands immediately before putting on and after removal of gloves. Gloves might have small holes or tears that are not noticeable and can increase the risk of contamination and exposure to microorganisms. For proper removal of gloves, grasp the outside of one glove at the wrist. Do not touch your bare skin. Peel the glove away from your body, pulling it inside out. Hold the glove you just removed in the gloved hand. Peel off the second glove by putting your fingers inside the glove at the top of your wrist. Turn the second glove inside out while pulling it away from your body, leaving the first glove inside the second. Dispose of the gloves safely. Do not reuse the gloves. Again, clean your hands with soap and water immediately after removing gloves. Budgets are always tight, but to the extent it's feasible, try to ensure adequate supplies to minimize the sharing of high-touch materials like art supplies, books, and electronic devices. Or if these must be shared, limit use to one group of children at a time and clean and disinfect between each group. If food is offered at any event, instruct parents, legal guardians, or food service staff to arrange pre-packaged boxes or bags for each attendee instead of a buffet or family-style meal. Avoid the sharing of utensils. If before, sharing was caring, now, not sharing is caring. Keep each child's belongings separated from others and in individually labeled containers, cubbies, or areas and taken home each day and cleaned. Depending on your local conditions, your school or district may want to consider implementing occupancy limits or a cap on total attendance allowed on campus. Some schools are holding double daily sessions with half the student body on campus in the morning and the other half in the afternoon. Doubling your daily sessions also allows for a midday break on campus for disinfection. Alternatively, students may end up going to school only 5 days every 2 weeks. For example, grade 6 may be on campus Monday, Wednesday, Friday 1 week, and Tuesday and Thursday the following week. These are, of course, very difficult decisions to make with serious consequences for family and for learning. But approaching with the best available evidence and a spirit of transparency will help all of us get through this challenging and hopefully short period. For social distancing, we are going to discuss federal guidance, but you should consult with your local authorities as well. The CDC has established 3 steps that schools take as they come out of lockdown. Think of step 1 as baby steps and step 3 as something that feels closer to normal. Step 1 and 2. When conditions allow, move your classes and physical education classes outside to increase air circulation and reduce opportunities for transmission. Consider instructing students to bring a towel, small blanket, or similar item to sit on. You will want student and staff groupings to be as static as possible by having the same group of children stay with the same staff. For younger children, that should be all day. And as much as possible for older children, restrict mixing between groups and cancel all field trips, intergroup events, and most extracurricular activities. You will need to limit gatherings to those that can maintain social distancing, support proper hand hygiene, restrict non-essential visitors, volunteers, and activities involving multiple groups at the same time, and restrict attendance of those from higher transmission areas that are still in the more restrictive step or phase 1. You will want to space seating and desks at least 6 feet apart. Turn desks to face in the same direction rather than facing each other, or have students sit on only one side of tables and spaced apart. If advised by health authorities, you may need to close communal use spaces such as dining halls, libraries, and playgrounds. Otherwise, stagger use and disinfect in between use. Serve meals in classrooms and ensure the safety of children with food allergies. This is covered in more detail in our training for food and nutritional workers, but if a cafeteria or group dining room is typically used, serve meals in classrooms instead. Stagger arrival and drop-off times or locations, or put in place other protocols to limit close contact between parents, guardians, or caregivers as much as possible. Create social distance between children on school buses. For example, seating children one child per seat every other row where possible. Our training for bus drivers has more details. During phase or step 3, most of these restrictions will stay in place, but a few may begin to be loosened. Allow very limited mixing between groups. Gatherings, events, and extracurricular activities are allowed again if those attending can maintain social distancing and use proper hand hygiene. During this phase, non-essential visitors, volunteers, and activities involving other groups may be allowed on school grounds in limited numbers, but restrict attendance of those from higher transmission areas. Continue to consider staggering arrival and drop-off times or locations, or put in place other protocols to limit close contact with parents, legal guardians, or caregivers as much as possible. Here are some of the changes to your policies and procedures you may want to consider. Designate a staff person to be responsible for responding to COVID-19 concerns. Employees should know who this person is and how to contact them. Actively encourage sick employees and students to stay home. Sick employees and students should not return to work or school until the criteria to discontinue home isolation are met. If a student becomes sick while at school, they should be sent home on a form of transportation other than a school bus. Monitor staff absenteeism. Monitor health clinic traffic. Create a communication system for staff and families for self-reporting of symptoms. Support coping and resilience among employees and children. If feasible, conduct daily health checks like temperature screenings and symptom checking of staff and students. Health checks should be conducted safely and respectfully and in accordance with any applicable privacy laws and regulations. School administrators may use examples of screening methods in CDC's Supplemental Guidance for Child Care Program and CDC's General Business FAQs for screening staff. We've included both of these documents in the resources area. Discipline and behavior are unique to each school and district, but you will want to devise a plan for corrective action before it comes up so that you aren't caught flat-footed when a student refuses to comply with, say, social distancing requirements. If anyone tests positive, work with school administrators, nurses, and other healthcare providers to identify an isolation room or area to separate anyone who exhibits COVID-like symptoms. Inform local health officials, staff, and families immediately of a possible case while maintaining confidentiality consistent with federal and state privacy laws. Inform anyone who is sick not to return until they have met CDC criteria to discontinue home isolation. If a person does not have symptoms, follow appropriate CDC guidance for home isolation. Inform those who have had close contact to a person diagnosed with COVID-19 to stay home and self-monitor for symptoms and to follow CDC guidance if symptoms develop. Close off areas used by a sick person and do not use before cleaning and disinfection. Wait 24 hours before you clean and disinfect. If it is not possible to wait 24 hours, wait as long as possible. And ensure safe and correct application of disinfectants and keep disinfectant products away from children. In the event a person diagnosed with COVID-19 is determined to have been in the building and poses a risk to the community, programs may consider closing the entire school for a short time, 1 to 2 days, for cleaning and disinfection. Thank you for joining me today. I know that is a lot of information, but by working thoughtfully, we can help keep everyone as healthy as possible during this difficult time. While these are general nationwide guidances as of the recording of this video in June 2020, please follow the most recent requirements from the federal, state, and local government. If you have any questions on items covered in this training or need additional assistance, please feel free to reach out to me at info@matthewshrconsulting.com. Thank you and stay healthy.